Good afternoon, everyone. Is the slide presentation up and ready to go?
Yes, it is.
Okay, great. So I'm just going to switch to that first slide from the title page. And I know a lot of you have probably seen some of this information before, but we wanted to just start by getting everyone on the same page and making sure that you're aware of exactly what COVID-19 is and also what it isn't. So COVID-19 is a new coronavirus or novel coronavirus that has not been previously identified. And what that means is that our bodies have never seen it before, and presumably we don't have any immunity to it. Most other viruses that go around, we've seen at some point, at least a variety of that virus at some point in our lives, and we have some immunity. Coronaviruses normally cause the common cold. In fact, they cause about 30% of the common cold that we see in general. So this one, COVID-19, causes respiratory illness ranging from a very mild cold to severe pneumonia. Symptoms typically start 2 to 14 days after someone is exposed to an infected person, but usually we see the disease start in about 4 to 5 days. And we know from data in China that most people, or over 80% who are diagnosed, have mild disease. And it's really important for people who are reading articles and watching the TV to know that the numbers that they're showing don't represent everyone who has the disease. They're only representing people who are diagnosed with the disease. And so whenever you see a death rate or a hospitalization rate, those numbers are always inflated. And in public health, we take into account how many people are out there that haven't been diagnosed, which are usually the milder cases or even cases with no symptoms at all. Next slide. So COVID-19 is a lot like influenza in some ways and different in others. So similar to flu, some people are at higher risk of complications, individuals over 60 years and those with underlying medical conditions. And that is what I really want you to remember, is that these people are at the highest risk. And we need to make sure that anyone in this high-risk category is doing everything they can to protect themselves. Unlike influenza, children tend to have much milder illness than adults, and that's actually been proven now with multiple studies showing that far fewer children have severe disease, and we just simply aren't seeing them hospitalized hardly at all, and they very rarely have critical disease. In fact, there's known to be only one death in the entire world among somebody under 18. So unlike influenza, there is no treatment or vaccine, and that limits our options to what we can do to protect ourselves, but we still have tried and true ways. And according to the World Health Organization, adults are really the spreaders of this disease. We know that kids can become infected and they can spread it, but because of their milder symptoms, they're less likely to spread it to adults than the other way around. Next slide. Well, how does it spread? I hear all the time that there is concern for airborne spread. Airborne means something very specific in public health, and COVID-19 spreads through droplets. That means, similar to colds or the flu, when someone coughs or sneezes, it produces tiny droplets, and those droplets can travel about 6 feet. They can land on a surface, and if you touch that surface and then touch your hand to your mouth or your nose, that's how the virus gets in your body. So that's why we're constantly talking about staying home when you're sick, because if you are coughing and sneezing, or even if you're not, and you're just talking and the little droplets of spit, they can actually travel a full 6 feet. So staying home when you're sick is number one. Number two is making sure we're wiping down those high-touch surfaces a couple of times a day so that people won't touch those surfaces. And then number three is, of course, not touching your mouth and nose, because that's how the germs get in. Again, there's no evidence of airborne spread. This germ cannot travel across the room unless you're in very specific healthcare circumstances, like getting a bronchoscopy or giving CPR. That is the only time when there is any evidence of airborne spread. Next slide. Well, how contagious is it? I've been using this diagram to visualize something that we use in public health. It's called the R0, but it's really a measure of how infectious a particular virus or organism is. And the two that I circled are the two I want you to focus on. COVID-19 has an infectiousness factor of between 2 and 3 typically. So for every person who's infected, 2 to 3 people will get infected from that person. When we look at seasonal flu, it varies from year to year, but that number is usually between 1 and 2. In order to stop a disease from spreading, we need to get that number down below 1. This is definitely more infectious than influenza, and that is why we can't necessarily use all the same modeling for flu that we're using for COVID-19. And in some ways we treat it the same, but in other ways it's different. Next slide, please. How severe is it? China had over 80,000 cases. 81% of them had mild disease, and then a paper that came out later just looking at children showed that 94% of children diagnosed had mild disease. Now remember, these are people who are diagnosed with a test and not people who never got a test, and we know that just like here, there was a shortage of testing in China. So these are vast overestimates of severe disease. What they showed is that there was between 1.4 and 2.3% mortality among those who were diagnosed. So that's simply taking the number who died over the total number of people diagnosed with a lab-confirmed case and the mortality. Again, that is a vast overestimate, and that has been borne out in multiple studies among experts. The World Health Organization calculated a crude mortality, again, that's just the number who died over the total number who were diagnosed, between 3 to 4%. And then when world experts got together and included all of the cases who weren't diagnosed, they believe the actual mortality is less than 1%. Seasonal flu mortality is also less than 1%, but it's at the bottom there at 0.1 to 0.2%. So we do think the mortality of this virus is slightly higher than flu, but it is not 10 times higher as you may have heard in the media. That is not accurate. So this is similar to a very severe influenza. And I want people to understand, I think when I say that, people think, oh, she's downplaying it. I have a lot of respect for influenza, and I worry every year when it comes around. So when I say it's similar to severe influenza, that's concerning to me. But what it's not is something like SARS or MERS, which has a much higher mortality rate. Next slide. So how do we prevent it? Just like the flu, we cover coughs and sneezes, wash our hands, and use hand sanitizer. Hand sanitizer is very effective unless you actually have visible soiling on your hand. So, and I don't want to get gross here, but if you sneeze in your hand and you can see stuff left behind, you need soap and water. Hand sanitizer isn't going to cut it. If you don't see anything on your hands, hand sanitizer works really well. Avoid touching your face, particularly your mouth or your nose, and we talked about how that's how you get the germs in. So you can touch a surface that's contaminated and not get sick as long as you don't touch your face. So you've got 2 barriers there. And then staying home when you're sick is the most important thing. And I will tell you that I had the tiniest tickle in my throat, and I am home. I am not going to work. I'm working from home because we can't afford to take any chances. So social distancing, we're going to talk more about later. But I wanted to cover this important thing. There's a lot of questions about should I wear a mask? And everyone in public health agrees, no, if you're healthy, you should not wear a mask. The only people who should be wearing masks are people who are sick and have to be out and about. If you have to buy groceries or have to go to a doctor's appointment and you're having symptoms, make sure you wear a mask. Otherwise, please save the mask for our healthcare workers who are taking care of our sickest patients and need to protect themselves and maintain our healthcare system. Next slide. So now I'm going to talk about COVID-19 in the U.S. These are yesterday's numbers. I apologize. I couldn't get them updated for today, but there's over 15,000 cases and 201 deaths. And as we all know, every death affects us. And it's just really important that we're all doing everything that we can to minimize the consequences, particularly for those who have high risk. This next slide is a picture of an epi curve, and this is the bread and butter of public health. And I wanted to show it, even though it's a couple days old. I wanted to show it because you hear the phrase flatten the curve a lot. When we have a curve, we always have time on that horizontal axis, and we have the number of cases on that vertical axis. And we map the number of cases that we see every day. And when we talk about flattening the curve, it means decreasing the total peak of that curve so that we don't get as many cases over time, and that maybe we decrease the duration of it. But what I can tell you is it will not stop the outbreak. The measures that we have available to us now are not going to stop it. We can just decrease the impact until we get a vaccine. That is the only thing that has ever been shown to actually stop an outbreak, unless in a disease with these characteristics, unless we get lucky and there's some seasonality to this. Next slide. So this is what COVID-19 in Arizona looks like today. We have 234 cases confirmed, and tragically we have 2 deaths, both of which have been in Maricopa County. In the county, we have 139 cases, all of which are in adults, and this number is almost doubling daily. We've had 25 cases hospitalized, so that's just under 1 in 5 hospitalized, and a total of 7 individuals, or 5%, that are critically ill. And again, 1% have died in Maricopa County. So I just want to highlight again, there are not 139 cases in the county. There are many, 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 many more. We don't have the capacity to test, which we'll talk about more. So you should assume that there are many more cases for every single one that we confirm in a laboratory setting. But you should also know that it's the most severe cases that are getting tested. So these numbers represent the most severe cases overall, and they're going to overestimate the severity of the illness here in Maricopa County. Next slide. So I just want to clarify these 2 terms. I think they're used interchangeably in the community, but in public health they mean something very different. Isolation is keeping people with fever or respiratory symptoms, any symptoms, home and away from others, and it is absolutely critical to decrease the spread of this illness. I just can't emphasize that enough. It's the core. Quarantine is when we keep those who are exposed to an infected person but don't have any symptoms home and away from others. Public health recommends quarantining of household members of a confirmed case and somebody who never got tested at all. So because testing is limited, we have to assume that every cold, every respiratory illness that anyone has is COVID-19 until proven otherwise. And therefore, if you've got someone in your household that either has been diagnosed with COVID-19 or just has a cold, we're asking all of the household members to stay home for 14 days. We know that's a lot, but that is the fundamental way we're going to reduce the spread of this disease. And there's only one exception to that, and that's healthcare workers. We need our healthcare workers to be working and taking care of the people who are diagnosed and in the hospital. So what we're asking all of the healthcare system to do is monitor their healthcare workers daily for fever and symptoms and allow them to work until they become symptomatic, at which point they have to keep them home. Next slide. So what is our public health strategy overall? It's absolutely critical to maintain everything on this slide for the long haul. And I don't mean to beat this to death, but isolation of all sick individuals, regardless of whether or not they have been diagnosed with COVID-19, is just the fundamental basis for everything we do. We investigate cases for close contacts. As we get further along and there's more cases, we might not be able to do as close of an investigation, and we're actually relying on cases to let their contacts know that they've been exposed. We quarantine household contacts, which I talked about. We notify other close contacts so they can watch for fever and symptoms and stay home immediately if they develop them. And then we need high-risk individuals, so those greater than 60 or with chronic medical conditions, to avoid sick people at all costs and avoid groups over 10. We're monitoring all healthcare workers daily for fever and symptoms, and we are doing some social distancing right now. Next slide, please. So what is social distancing exactly? It's what we call non-pharmaceutical intervention. So we don't have a vaccine and we don't have treatment, so we have to rely on things that have nothing to do with treatment or drugs. What it means is avoiding unnecessary travel, making sure that only essential visitors are going to the hospitals and long-term care facilities where our most vulnerable people are, canceling non-essential mass gatherings, avoiding groups greater than 10, teleworking when possible, and I put cancel schools ? Because the literature is very clear that canceling schools doesn't have any impact on the epi curve or on spreading of disease. We understand why the governor elected to do this, just to create some uniformity across the state, but it doesn't actually have support in the literature as far as affecting the outbreak. Closing bars and dine-in restaurants is a slightly more extreme measure of social distancing. And then, of course, sheltering in place is the most extreme thing that we can do. Next slide, please. So this is a marathon, not a sprint. It's going to take us a full year to get a vaccine. And we need to maintain the minimum social distancing strategies until we get that vaccine, which is at least a year away. So we've got to recommend things that people can actually maintain. Other strategies like teleworking, canceling mass gatherings, and limiting dining in should be added during periods of high spread. We're in moderate spread right now, and it's not unreasonable that we have those things in place. Sheltering at home is effective, but it's only effective if you keep it going until we get a vaccine, which is an entire year. So when we recommend sheltering in place is based on our healthcare capacity. That is our primary trigger in Maricopa County. Next slide, please. Why not shut everything down now? There's a lot of talk about this, and it's something that is really important that I know that we think about every day. We're constantly reading the literature. There are a lot of models out there, and I want you to understand what models are. They have a lot of assumptions in them, and they put in a lot of assumptions about the disease and disease transmission. But what they don't include is other societal harms that is caused from shutting everything down. So the published science from other countries says that if we shut it down too early, that the disease will just come right back afterwards. And we know that the disease will be reintroduced when social distancing is relaxed and spread will begin again. So there's a critical time when you can implement maximal social distancing, and it will actually stop the outbreak. And that requires enough of the population to already be immune from having the disease so that it won't continue to spread. And that allows you to do it for a short time so it doesn't severely impact the economy. Remember, most people will get a cold or a mild illness. And if you have people not being able to eat, increased domestic violence, increased child abuse, and all those other things to avoid young, healthy people from getting a cold, you can actually do more harm than good. And so what we recommend is doing short periods of maximal social distancing to reduce stress on the healthcare system, like when our ICUs are full. And I want to let you know that we are at such low capacity in our healthcare systems right now. We are not even close to where we normally are during flu season, and that's something we check in on every day. Next slide, please. Well, what if I get sick? If you test positive for COVID-19, we ask you to stay home for 7 days from the positive test or 72 hours after you're symptom-free, whichever is longer. And we ask you to stay away from others in your household. Stay in one room, have them put food by your door, and you can open the door and take the food away. If someone in the family has a mask, they can, of course, come in and take the food in with you as long as they're wearing a mask. If you go out and intermix with the rest of the people in the household, it's important that you, the sick person, wear the mask. If you have a fever or cold symptoms, please stay home for 72 hours until you're symptom-free. Sorry. There we go. Stay away from others in the household also. So household members are going to be asked to quarantine at home for 14 full days, and that's from the last day they were exposed. Other close contacts are allowed to go to work, but we ask that they monitor for symptoms and stay home immediately if they're sick. Next slide. That quarantine exception, again, is healthcare workers and EMS. We ask them to continue to work, monitor for symptoms, and follow the Maricopa County Public Health guidance. And every single healthcare system and and EMS or fire should have a system in place for monitoring their staff daily, not just exposed staff, but every single one, because we have to assume everyone's been exposed to some COVID-19. Next slide. So public health and privacy. I want everyone to understand that public health is automatically informed of positive COVID-19 tests. If you're just sick and you don't have a test, we won't know about it. But if you have a positive test, we are informed, and we will contact you and ask you to inform your close contacts. We're not going to share who you are or where you live or any other information that could be used to identify you. Not only is this a legal obligation, oh, sorry, I can hear some feedback. Could everyone put their phones on mute, please? Thank you. So this is not only a legal obligation, but we also don't want to put people who test positive at risk of being harassed. And that's really important because we've had individuals with other diseases actually get death threats. So when the media asks us, well, what part of town do they live in, and all these other questions, and you think, well, we have a right to know, I really want people to understand that if this were your family member, your child, or your parent, you would want their privacy protected, and you wouldn't want people to be able to piece together different information about them to find out where they lived or where they worked. And that's why we hold privacy to the highest level. It's both legally an obligation, and we do it to protect our citizens. Next slide. So why can't everyone get tested? And the answer is there just isn't enough testing for everyone to get tested who wants it. The Arizona State Lab is testing hospitalized patients and those who are the most sick and those who are in high-risk settings. There's not enough personal protective equipment, which is gowns and gloves and masks, for community providers to collect specimens safely, and we don't want them to put themselves at risk. And most importantly, there's not enough nasal swabs in the medium that you put the swabs in to test. So what's happening is there's a lot of providers who are hesitant to see patients and test them in the community. And if you can't get the materials to collect the specimen, you simply can't get the test. So that is what is limiting our testing. There's lots of commercial labs that will perform it, but it's those supplies that are limiting people's ability to get testing with mild to moderate illness. Next slide, please. So drive-through testing. Maricopa County Public Health does not have the resources to stand up drive-through testing. If we could, we would, but there's just a few hundred of us, and there's 4 million people in the county, so it just wouldn't be possible. The feds, our federal colleagues have mobile testing units, and I know that they're looking into bringing some out here, but I have not heard that that's been successful yet. We definitely have healthcare systems that are ready to stand up and ready to go, but they're waiting on having enough testing supplies to meet the demand, and we're hoping that will alleviate some of this inability to get testing. We've raised the request to get enough supplies and enough personal protective equipment to the highest levels, including all of our elected officials and the FDA, and we are doing everything we can to get those. And I just want to address that a lot of you heard that someone in the federal government just went online and ordered swabs. And I appreciate that they were able to do that. My guess is that they were able to get the type of swabs that are readily available with a wooden handle made of cotton. Those are easy to get, but you can't use them for testing. So we constantly go on and try to order these swabs, and they are all back ordered for weeks at a time. Next slide, please. So why can't we get the supplies? There's a big supply chain disruption. What I've learned recently is that these swabs are manufactured in Italy. That's a huge issue because they're on complete lockdown, so they're not able to put out the products that they used to. The most common requests are N95 respirators, surgical masks, isolation gowns, gloves, and eye shields. We don't maintain a local cache of these items. We have a very limited supply, and we've been able to supply EMS and fire so that when there's an emergency, they can protect themselves. Next slide, please. Well, what about the Strategic National Stockpile? We call it the SNS. The SNS is coming this week. The state already received it, and it's being distributed to the county today and tomorrow. Well, unfortunately, we know that the supply will not come even close to meeting the demand. We think we're going to get about 36,000 N95 respirators, and the request from the field is several million respirators. So our expectation far exceeds the reality of what we're going to get, and we are going to, next slide please, we are going to prioritize the healthcare workers who see the sickest patients and those who are at the highest risk of spread. And we're urging outpatient providers to use telemedicine when they can and ask patients at lower risk with mild to moderate illness to do self-care at home, and then seek further care if their fever doesn't go away or they develop shortness of breath or they start to get worse. Next slide, please. So we have some really vulnerable populations that we want to make sure you know that we're working with every day. Those in our long-term care facilities, mostly over 60, we're actually doing active surveillance among long-term care facilities to learn early when there's an outbreak so we can help them manage it. Additionally, those experiencing homelessness or unstable housing are very vulnerable to this because they don't have a place to isolate if they get sick. So we're working closely with the City of Phoenix and our county colleagues to find alternate locations for housing and wraparound services to separate those who are sick from others, separating those who are at high risk from others so they're not in crowded settings. So if one person gets ill, they won't all get infected. And also to maximize hygiene facilities like hand washing stations and to decrease crowding so we can maximize social distancing in those populations. Next slide, please. So what can the city do? We ask you to make sure employee sick policies allow for sick people to stay home, allow teleworking wherever possible, and increase cleaning of those high-touch surfaces that people can accidentally touch. And please remember, it is your individual responsibility not to put your hands in your mouth or your nose. It's harder than it sounds, but we have to learn to do it. Please support public health with local community efforts, supporting services for individuals with homelessness, wraparound services like bringing them food, and helping people who are in isolation get their needs met. And lastly, the biggest thing you can do to help us is to share accurate public health information. There's a lot of misinformation, wrong information out there in the media, and it's really important that you're listening to public health and also listen to folks at the local level. You all work for the local government. You know that locals know what's happening locally. Try to focus on what people are telling us in this area rather than what people are doing in other states and at the federal level, because we know best what our current situation is here. Next slide. I'll take any questions that you have, and this is our public hotline if you require any information, and it is actually manned by human beings. All right, I'll take time for questions.
Thank you, Dr. Sunenshine. And it turns out the CDC
Mayor?
just released updated numbers, and it looks like, unfortunately, deaths in our country have doubled just since you put the PowerPoint deck together. So,
Mayor?
Councilmember questions. Councilmember Garcia.
Mayor?
Yes, Dr. Sunenshine. What? Oh, okay. Deborah Stark. I'm sorry, I couldn't tell the voices apart. We'll go with Dr. Stark, and then we'll go with Councilmember Garcia. We'll go with Deborah Stark, and then Councilmember Garcia.
Mayor.
Councilwoman Stark.
Mayor, thank you. I've had the opportunity to meet the doctor. I must say we're very, very lucky to have her. She's doing wonderful work. My question has to do with surgical masks. I've seen on social media a number of groups are sewing masks to try to support our health care system. Is this a good idea, or do you have suggestions on what we would do with regards to sewing these masks? Is there any materials we should be using? That's my question.
It's a great question, and I'm definitely not an expert on self-manufacture of personal protective equipment. What I can say is that there are good recommendations out there for extending the life of the personal protective equipment we have, so not using a different mask every single time we see a patient. It has its own concerns with it. As someone who is trained in infection control, it makes me cringe, but if you're careful about not touching the outside of the mask, you can take that mask off and then put it back on for the next patient. So I think conserving the masks that are manufactured is the most important thing we can do. And that's one of the reasons why, even though I don't support shutting everything down, I'm very much in support of shutting down elective surgeries, because that uses a lot of masks and other personal protective equipment that we can use to take care of patients who need it acutely. So conserving is number one. Number two is we have someone in the county designated to take donations of surgical masks from dentists, most of which who are closed down. And the reason why dentists are closed down is because the majority of their work is elective, and they typically wear surgical masks, but most of their procedures generate aerosols. So in order to practice safely, a dentist needs to be wearing an N95 respirator. So the American Dental Association has actually asked them to cancel their practices. So they have quite a few surgical masks that we are now taking and collecting and distributing. So the next thing is using what we have available. As far as making our own, I will say that a certain healthcare facility is making their own eye shields, which is probably much easier to do with a rubber band and a piece of plastic. But a mask, I would be concerned because you need to make sure that the pore size is the right amount to keep secretions in. So I can look into that, but I'd have to get back to you on the specifics.
Thank you. Councilmember Garcia.
Thank you, Doctor. That was really helpful. I had a question on the vaccine. If you could expand a little bit. You said it's a year away, but even when it comes, can you explain a little bit about how a vaccine works? And also, when you're talking about literature, what are you referring to?
So there's a lot. Well, let me start with the vaccine first. As soon as a new strain of any organism is identified, in this case, China identified it, and they posted the sequence to the internet, basically. And that is why so many different labs and facilities are able to produce a test so quickly. Well, CDC takes that strain and immediately starts working on a vaccine before they ever even know that there's going to be an outbreak. A lot of people don't realize that we're constantly starting the development of vaccines because we don't know where things are going to go. So from listening to the Vice President and particularly Dr. Anthony Fauci, you hear that this vaccine is probably being manufactured than any other vaccine in the history of time. So it's moved quite quickly. But that being said, they still have to make it, and then it has to go through 3 sets of trials. The first to make sure that it's safe for humans, the second to make sure that it's effective, and the third to figure out exactly what dose and in what populations it's safe and effective. And so that typically takes a year. Once they manufacture it, they're not going to have enough for every single person in the population. So Arizona has a system in place where we'll have a vaccine, I forget what the official name of it is, but it's basically a vaccine recommendation committee. The federal government will assemble a team of experts. They'll make recommendations to the state. Then the state will do the same and make recommendations to the county. And if I had to guess, what they will do likely is prioritize individuals at the highest risk first, because they're a very distinct population, and we want to make sure that we're protecting those who are most likely to be hospitalized or even die from the disease. And then your second question, I'm so sorry, could you remind me?
Yeah, and I'll put another. When you refer to literature, what do you mean? And then also if you can expand on the healthcare capacity triggering the sheltering, how do those numbers come in, and how do you keep track of that, or where is that at? You said it was even lower than it was with the flu. Can you expand on that as well?
So when we talk about the literature, there's really, there's 2 types of literature out there. And I think what a lot of people are focusing on right now is modeling. And modeling is very useful for helping to make decisions, but it's generally not accurate, because in order to model, you have to put in a lot of assumptions about the disease that we don't yet know. You also put in a lot of assumptions about the population that may not apply to the entire country equally. And there's a lot of different models out there with very different results. And what I can tell you is they're assuming that this disease is just like influenza, which it's really not. It spreads more quickly, but in all likelihood, we think that there's a lot of mild disease out there that isn't similar to the flu. And most importantly, influenza spreads predominantly among children and goes from children to adults. And we know every year that when we see our flu numbers rise, they rise in the school populations, elementary schools particularly, about 2 weeks before everyone else. So they are what pushes the spread. So you can't use the same models for influenza that you do for coronavirus because it's really spread in different ways than the flu is. Not different ways as in it's the same type of spread, but it's different populations that spread it. And so I want to caution folks about looking at the models. I also want to caution folks about assuming that what they're doing in California or Washington is what's right for Arizona. Washington, California, and New York are in a very different situation. They've already exceeded their healthcare capacity in many ways, and they've already exceeded their PPE capacity. It's very important that if you implement those strict measures, that you have an exit strategy. And what I don't think is feasible is to have everyone shelter in place for the next year. So you have to implement it at the right time so that you have an exit strategy. So the other type of science that's out there is the actual data of what we're seeing in countries. And the China data is definitely the best data that we have. But actually the data from South Korea is really helpful because they've done more testing than any other country. And those are probably the best estimates of what we think the actual mortality of this illness is, which is likely to be far less than 1%. What we know is that you can't rely on just those who test positive. The good news is public health deals with this all the time. We have lots of diseases that we can't test everyone, particularly flu. So we know how to estimate how many people are out there that haven't been tested based on the people that we are testing. And that's different than modeling. That's actually using the numbers we have to estimate what we're missing. And those numbers, those estimates are what we use to base our triggers on for when we need to go to more extreme measures. So a lot of people think, oh, if you're not testing, how do you know what's happening? And the answer is we do this all the time in public health. And we have lots of other measures, including something called influenza-like illness surveillance that we can track. And that tells us how many people are sick, but not necessarily diagnosed.
So I had another question. So when it comes to our first responders, what are some, just given the lack of masks and the lack of sanitizers, what are some concrete steps that our first responders can actually take to make sure that they also keep safe?
Great question. So we've been working with our EMS partners, and one of the things that we've instituted, particularly at 911, is they're automatically being asked, the caller's being asked, does this person have respiratory symptoms, or I think they're asking about the household, but particularly, does this person have any symptoms of COVID-19? So that way, the EMS providers who are being dispatched can have PPE available and ready ahead of time. Now, if there's a situation where you don't have that information as an EMS provider, the best thing you can do, unless it's an absolute emergency, so obviously if somebody is having a heart attack or if somebody is not breathing, you just need to put your PPE on and go in and take care of them. But if somebody is in a non-emergent situation, stand 6 feet back from them and say, are you having any cough, shortness of breath, sore throat, or other respiratory symptoms? And if they say, no, I just fell and I hurt my hip, then you don't need to use unnecessary gowns, gloves, and masks. But just doing that from 6 feet away will protect the healthcare worker and avoid using that limited personal protective equipment that we have. Next question.
Other council member questions?
I have a question. So unfortunately, we lost a worker to COVID-19, and that person was in a building. I understand that 14 days ago, they had been placed or was in the hospital, but as you could tell me, Dr. Sunshine, because you have a lot of pressure on you, and we're all following you, and a lot of pressure. So my question is, 14 days ago, this person entered the hospital. However, we don't know how long this person had COVID-19 or the coronavirus and was at work. So what do we do? I mean, because those employees at a certain point were at risk. One of those employees could be carrying it, and we don't know. So what is your recommendation in moving forward? Because my recommendation would be to shut down the building, sanitize the building, and have those employees working at home. But I would like your advice.
Thank you, and I'm glad you brought that up. And I just want to say how sorry I am that you all lost one of your own. And this is tragic, and it's one of the reasons why I keep emphasizing that people who are over 60 with chronic medical conditions, they need to be teleworking right now. They need to be staying home as much as possible. And we know not everyone can do that, but as much as possible, they need to. And I want to answer your question about what to do now, but I really want to address some false information that's been going on in the media this weekend. And I think it's important for your community and everyone in the city of Phoenix to know this. So this individual did not go to the hospital. This individual was found deceased in the home. And it's important for people to know that when people are found deceased in the home, we have a system in place with the Maricopa County Medical Examiner that if there's any suspicion that COVID-19 could be involved, we test those individuals right away. So if there's someone found in the home, they're tested literally at that moment when they're identified if they meet the criteria. And then that test is sent to a commercial laboratory, which it was sent immediately, took 3 days to come back. And then we were notified of that test result on Friday afternoon. We immediately called the next of kin, which is the family, and we will always call the family first. The most horrible thing in the world is to find out about the cause of the death of your loved one from colleagues of them or on the TV rather than being the first one to know. So we will always notify the family first. And literally, while we were on the phone with the family, we held a meeting with the city of Phoenix. So I want you to know that you are notified within hours of this individual being identified as a case. So I understand that the media doesn't understand how we do things in public health, and they don't understand that testing takes time, but that notification occurred as seamlessly as it possibly could. So what are we telling those employees? First of all, we had long conversations with the particular supervisor. We identified which meetings that individual was in and which people were considered close contacts. So the people at highest risk whenever we have someone diagnosed are the people in the households. That's one of the reasons we call them first, is we make sure that they're going to stay home and away from others for 14 days if they haven't developed symptoms. And if they have, then we make sure that they stay away from others until 72 hours after their symptoms resolve and or 7 days after their positive test. So after those household contacts, the next people at highest risk are those who've spent more than 10 minutes face-to-face with somebody who had the illness. And we identified each one of those people, and the city of Phoenix just went above and beyond and actually elected to call each of them individually to inform them that there was some contact. We stayed up late Friday night writing a letter and made sure that everyone got that letter. And what we're asking those folks to do is to monitor daily for fever and symptoms. And the moment they get those symptoms, they need to stay home and away from others. So you talked about closing the building and sanitizing it. you don't need to sanitize anything. Normal household cleaners disinfectants are highly effective at getting rid of the virus. So what we talked about was what they were cleaning with, what areas they were cleaning, and they confirmed that they had already put intensive cleaning into place and wipe down all of those surfaces. And that is enough to get rid of the virus in the environment. Whenever you read those studies about how long the virus can stay in the environment, that is if you haven't applied a disinfectant on them. We're lucky that this virus is susceptible to normal household cleaners. So that is why I'm not recommending shutting down the building, and we're asking all those employees to monitor for symptoms to make sure they stay home when they're sick. And I know City of Phoenix has an excellent leave policy so that if anyone even has the slightest symptom, they're allowing them to stay home.
Dr. Sunenshine, could you talk about the risk of disease transmission prior to the onset of symptoms and the concern that waiting until symptoms show up is too late to stop community transmission?
Yeah, that's another great question. And there are so many questions about this from healthcare providers that I sent a letter out to every healthcare provider in Maricopa County. And the truth is, there is some spread from people who don't show any symptoms. We know that to be true. We know that that's true for influenza, and we know that that's true for lots of other respiratory viruses. So we know it exists. We also know that it's not the main way that the virus spreads, because it's transmitted on those droplets when you cough or sneeze, right? So generally speaking, and I don't want to get gross, but I need you to visualize the more droplets that are being expelled during a cough or a sneeze, the more virus you're going to have on those droplets, and the further that virus is going to spread. So you can absolutely spread far more virus when somebody is symptomatic than when they're not. So how does it spread when they don't have symptoms? That person would have to touch their mouth or their nose and then touch a surface. And then that surface would have to not be cleaned, which we're doing everything we can to have people cleaning high-touch surfaces regularly. And then someone else would have to come and touch that high-touch surface, and then before washing their hands or sanitizing them, would have to touch their mouth and their nose. That is how asymptomatic spread occurs. There is a possibility that if somebody sort of spits a little bit when they talk, that it could be spread that way. But again, there's just a lot less chance of it spreading when they're asymptomatic or when they have no symptoms than when they have active symptoms. And so what I tell people is, we all know it's there. We acknowledge it. That's all the more reason why we have to focus on what we can control, which is touching our mouth and nose and washing our hands, and recognize that if every single person who is exposed to a COVID-19 case, the way that we would have to manage asymptomatic spread would be to have every single person in Maricopa County shelter in place until there was a vaccine. And if we did that, it would truly shut society down. So what we're asking is that we focus on those who are symptomatic, which we know will decrease the spread most of all, and then we ask those who are at highest risk to shelter in place, so that the people who do get infected will have mild disease that will build up the immunity in the population. We're not trying to get anyone infected, but those are the people who will have mild disease, and that will likely decrease the spread the best without having those severe consequences among high-risk people.
Thank you. When you look in Maricopa County, we have some communities in particular that have pretty significant concentrations of older adults, much higher than some of the communities that have had the worst impacts. Is there anything you're thinking about for those communities? Are there lessons learned or impacts or modeling assumptions that you are considering?
No modeling assumptions, no, just that those communities with more high-risk populations, long-term care facilities, we learned from Washington that is the worst-case scenario. So if I were a long-term care facility and I was seeing a lot of respiratory illness, what I would do is I would minimize group dining. I might have people dine in shifts. I might have them dine in their rooms. Again, you can't prevent everyone from socializing because socializing is absolutely a fundamental human need. So we've got to balance the risks and the benefits. But those areas, there's whole communities in Maricopa County that are, restricted to individuals over 50. This is not the time to have bingo. This is the time to play cards with a couple of healthy friends, go golfing, walking outside, really having people do active activities outdoors is the safest possible thing, and keep everything to small groups. And that, I just can't emphasize that enough for people over 60 with chronic medical conditions.
Mayor,
Councilwoman Stark.
Thank you. Doctor, you mentioned being outdoors. I got a text from one of my constituents last week. He was driving by a park and saw a cluster of children playing together on playground equipment. What about that kind of issue? Should we be cautioning, or should we even be talking about closing down playground equipment? Do you have any thoughts on that?
Yeah, I've been asked that question a lot. Because of the reasons I just mentioned, and because we have very dry climate, droplets just don't survive very long. They dry up very quickly in our climate. So being outside is the safest place to be during an outbreak of a disease that's spread through droplets. So what we don't want people to do is have to sit still in their home for months and months and months. We want people to go outside. We want people to stay 6 feet away from each other. I know my own parents went out to take a hike, and the trailhead was so crowded they turned around and came home. They're over 60, by the way, and I was proud of them. So if you go to a park and you can't stay 6 feet away from others, or if you go to a trailhead, find another trailhead. But it's good for people to be outside, and it's good for them to stay active, and that's the only way we're going to get through this for the long haul. Regarding children, this disease just isn't severely affecting children. We've already closed down schools, and I think if you keep children cooped up inside for long periods of time, again, probably doing more harm than good, and I would not close playgrounds either. Would I go out there and try and disinfect the playground equipment once or twice a day if that's possible? Absolutely. Would I make sure that kids have hand sanitizer and are washing their hands? And would I teach them not to touch their mouth and their nose? Definitely. But I wouldn't close playgrounds.
Councilman Nowakowski.
Thank you, Mayor. Doctor, thank you so much for all this information. One of the things here in the city of Phoenix, we're trying to increase cleanliness and sanitizing everything that we have, all of our different facilities, from our police officers, firefighters, to our own housing departments and stuff like that. But one of the concerns I have is that our police officers, firefighters, and even the bus drivers and some other employees like parks and rec individuals are out there in the community on a daily basis. And what can we do as a city to make sure, especially, let's say the buses, right? We're in a confined area where you have over 40 people in a bus, and you have one bus driver that has people that are coughing and sneezing around that individual. What can we do better as a city of Phoenix to make sure those type of confined areas, which is a bus, the light rail, and those other areas that people need to use for transportation? Some of these individuals, that's their only means of transportation, and they're actually the individuals that are cleaning our offices and cleaning the hospitals and cleaning other facilities that are needed to make sure that our men and women aren't getting, basically that they're sanitized and that they're clean and that the virus doesn't pass on. So what would be your suggestion on that with the buses and light rail?
Right. So you just raised some really important points. Buses and light rail, I think, are hands down the hardest one because, as you mentioned, this is often people's only means of transportation. And you want to keep the people who are healthy, who are in those enclosed spaces. So I think this is really tricky, and I don't want to act like I know the answer. There's a couple of possibilities. Number one, and the easiest one to do, is to try to wipe down all of those the seats and the surfaces, and particularly the handrails and the things, whatever you manipulate in order to get the bus driver to stop. Those things need to be wiped down as often as possible. I think the other feasible thing to do would be to have a giant pump of hand sanitizer, so that when people got on the bus, actually have them use the hand sanitizer. I think that one's feasible. What gets harder is if someone comes on and is coughing and sneezing, and they might have allergies, they might be sick, you don't know. That's a difficult situation. I don't know that we can ask them to get off the bus. I don't know if it's feasible to keep them 6 feet away from everyone. The one thing that you might consider is giving the bus driver access to just a couple of surgical masks, which, by the way, are very difficult to keep around. Everyone is stealing them. And maybe they could offer that person a mask so that they didn't infect others. But I just don't know about that, and I'm open to any suggestions that you all have.
And, Doctor, this is Councilman Nowakowski again. And how about our employees that are basically the bus drivers and that are conducting the light rail, that's a part of their daily operations and the necessity for us to provide those types of services? How can we make sure that they're protected on a daily basis?
So again, it's doing everything we can do to keep people with respiratory symptoms off of the transportation, and keeping the sick people, if they can wear a mask and use hand sanitizer, that's ideal. There's enough community spread of this illness that all of us need to assume that we're being exposed at some point in our day. And that's definitely true for anyone who interacts with members of the public, because we know that people can, have hardly any symptoms at all and are going to be out and about. So that being said, I would say if there is a way for bus drivers who have chronic medical conditions or who are over 60, if there's a way to give them time off, that would be preferable. I don't know if that's possible, but in general, it's really going to be just keeping anybody with symptoms more than 6 feet away from them, and maybe even having a rule: if you're coughing or sneezing, they have to sit, in a certain part of the bus and away from others. I'm not a city policy person, so I can kind of tell you what the science is, but I don't know what's appropriate in terms of the situation.
Thank you. Doctor, one more question. This is Councilman Nowakowski again. We're getting calls from individuals that are saying that, residents from the city of Phoenix, that are saying they're calling their doctors with the symptoms and all that, and they're not taking individuals seriously, and that they want to get tested. So one of the things, can they use this public hotline if their own doctors aren't taking them serious, that they can call for a second opinion or so?
So unfortunately, we've taken more than 10,000 calls from the public and providers just in the last week, I think. And 90% of those calls are people who are frustrated because they have symptoms and they want to get tested. And I have to tell you, I understand how anxious it is you could be when you're experiencing symptoms and we know there's this disease out here. What I can tell you is that there is nothing that public health can do to get individuals with mild to moderate illness tested. If they're unable to get their provider to test them, there's nothing we can do for them. We're hoping that this drive-through testing, when we have enough supplies, will help alleviate some of that. But that commercial testing is the only way that they're going to have to get tested. The state lab will only test people who are severely ill, typically those who are hospitalized. So they can call the public hotline and get information, but we can't help them get tested because we don't have access ourselves.
Thank you.
Vice Mayor.
So given the information that we got from the doctor, I've gotten a couple of phone calls in the last few days, and when it comes to our parks, so I just got a lot of peace of mind with what she said about the parks and making sure that people are out. But then at the same time, are there special instructions we can put in our parks in terms of recommendations of how many people can actually be at the park? What is the safest way to use the park right now without saying that we're restricting everyone and anyone to come into the park? Just because I think as this starts to as the spread continues to get bigger, I think we're going to have a lot more concerned constituents that will call and say, hey, listen, there's a bunch of people in the park, and I'm sure we're not going to have enough park rangers to get out there and get to every single park. So is it possible to put, maybe, specific instructions or instructions that we would like people to follow as they're coming into the park that we want them to be aware of?
Mayor, Vice Mayor, I think that's a great idea. Oh, sorry. I think that's a great idea. I would consider signage that says, please respect the other people in the parks. If you have symptoms of a cough, cold, or sore throat, please do not stay in the parks. Healthy people are welcome to be in the parks, but please stay 6 feet apart. And because I don't think most people know what 6 feet is, I would almost put a line somehow on the signs or say, this is 6 feet apart, and give people an idea of how far they need to distance themselves on the trails and in the parks, and really ask people to respect those boundaries around other people so that you can prevent the spread. And then I would encourage people to carry their own hand sanitizer so that, we don't have as many germs spreading in the parks.
Councilmember Garcia.
Well, Doctor, I had some questions about what's happening for the folks that are in the jails or in the prison system, and also thoughts on our booking processes and all those sorts of things.
Yeah, so we just had a call with Correctional Health this morning, and we've been talking to them almost daily. It's challenging because there's a lot of people packed into a very small space, but what we've come up with together is a system where anybody who develops any respiratory illness in the jails is being separated immediately from others. And then we're working out a system. We have one particular provider, I'll call them out. It's TGen, who is willing to do a screening test to determine whether these individuals have evidence of COVID-19. Now, it's not a diagnostic test, it's a screening test. But if we know that people have COVID-19, then we can safely separate them from others, but put them with each other so that you don't need an individual isolation room. We call that cohorting. And you can't do that unless you know that that's the disease they have. So we would screen them, and then we would do a confirmatory test to make sure that they have COVID-19, and that's diagnostic. But if you screen negative, it's quite sensitive, and then we would be able to put them back in the population, and that would keep COVID-19 from spreading in the jails. And so that's the process we're working on very hard with the jails, but it's obviously challenging because there's, a limited amount of supplies even to collect the specimens.
Councilwoman Pastor.
Dr. Sunshine, you had mentioned something about social distancing, and you had said that we should be 6 feet apart, but also a 10-minute maximum exposure. I looked that up on the CDC, and I don't see that anywhere, and I'm wondering where that came from.
Okay, so forgive me if I didn't explain that clearly. So that's sort of two different things that you're talking about. So one is the definition of a close contact, and the CDC definition of a close contact to a case is when you are within 6 feet of them for more than 10 minutes, and that is a CDC definition that we use. And when I talk about staying more than 6 feet away from people, that's because that's how far droplets are known to spread when we cough or sneeze. So if someone's 6 feet away from you, or more, just over 6 feet away from you, and they cough or sneeze, you're not going to get hit by any of their droplets. And that's why that's a nice safe distance to keep between people. But the more important thing, or as important, is not touching people unnecessarily. We know that transmits germs. This is a really bad time to shake hands, come up with a little bow or some other way to greet people other than shaking hands. Not the best time to hug all your friends. Keep physical contact just among family members as best you can.
Thank you.
Mayor, may I ask a question?
Yes, Councilman Waring.
Thank you. Just a second, let me pull it up here again. So Doctor, this is Jim Waring. I appreciate very much this presentation because you are an expert, but you've made this understandable for those of us, which is, I think, all of us who are not experts. There was one area where I just want to make sure, before I ask my question, I had clarity. On the slide that says, this is a marathon, not a sprint. It says we need to maintain the minimum social distancing strategies until we get a vaccine at least 1 year. So the way I interpreted that is that we're supposed to do the distancing, which I believe you just said was 6 feet. So is that your recommendation, do that for a year?
So I do not have a crystal ball, and I cannot tell you for sure that this virus will be spreading in a year. The reason why we pick a year is because we know that's how long it'll take to get a vaccine. And if it does spread for that long, that is how long we'll have to maintain social distancing. I think we're all hoping that there's some what we call seasonality to this virus, like there are other coronaviruses where they tend to be worse in the winter and less in the summer, and that will help minimize the spread. We're all hoping for that, but we just don't know. This is a strain that we don't know enough about. And what we've seen in these other countries is that it's so infectious that it will continue to spread until it can't spread anymore. So either enough people are infected that they can't get reinfected and it can't spread to anyone else, or we vaccinate. And so those are the two ways to build what we call herd immunity, which is the way that we can prevent diseases from spreading. And so we have to assume that we have to continue this for a full year unless we get lucky and it stops spreading for some other reason. But the science tells us that it will continue to spread until we have enough people who are immune that it can't spread anymore.
Well, I appreciate
and that's
that.
why we need to protect those people who are at high risk, so that other people who are younger and healthier are the ones who build up the immunity, and we protect those who are more likely to have severe disease.
So to follow up, the reason I was asking that question, I appreciate the clarification. So obviously the state and the city have closed facilities. Governor Ducey closed restaurants and gyms. And for example, at the city of Phoenix, we closed libraries because obviously, it's impossible basically to keep the spacing and have any of those three, and there are other examples too, but I just picked those three, to have those operations going and really keep 6 feet apart. I mean, maybe it's possible, I guess, in a gym if it's huge, or a restaurant that's just sparsely attended, but that's a different problem for the restaurant. But the library, it would be all but impossible to have the computer setups that we have to pass people in the stacks if you were checking out a book. It's just, for us, that recommendation has certain real-world consequences. We're probably not going to keep the libraries closed for a year. People use those facilities to contact the outside world. Not everybody has the internet, obviously, for example, so people using the computer use it for jobs, et cetera. We've already talked about the buses and the light rail. The buses particularly are used by people who really don't have other modes of transportation. So you can cancel, as frankly my family has done, you can cancel a trip that you're taking that's not an emergency, on a flight. But you're never going to be able to be 6 feet away from someone unless it's a really empty flight. How are we going to get past this? Because you've also discussed about a reoccurring, and it's in one of your slides. And I had heard that as well. Nobody was happier to see that it was warm this morning than probably people in the medical community in Arizona. Normally we wouldn't be rooting for hot weather, but this year I find myself going, yay, it feels warmer. I wonder when it's going to be 110. Can't wait. And dry. because that may help us here in Arizona. But then if it's just going to come back in the fall after we reopen stuff, how are we, you may not have the answers, but any guidance, like when would you be opening up the libraries? Because that is a decision that we have made, and it's got real world consequences, as I know you're aware, for large swaths of people. And, we're trying to make sure that this is not something that we're doing that isn't absolutely 100% necessary. And it's hard to tell. And a year just seems unrealistic to me. So I'm open to any suggestions. I think we probably all are.
Thank you for that. I think you've just highlighted probably my biggest concern about closing all these facilities. What is our exit strategy? And the answer is, I don't know. I don't have an exit strategy. I wasn't consulted before they were closed. I don't know whether it was right or wrong. I know that I would not have recommended closing them. And I think that it's important to be realistic about what the true costs and harms to society are from closing things. And I think that if enough people lose their jobs and lose access to food and learning and their livelihoods, that you're doing more harm than you are by having a minor illness. And I know people don't like to hear that, but I do public health for a living, and health is not just the absence of disease. It's being able to maintain food and nutrition and sometimes exercise and some socialization. So that's why I don't love these models, because they only take disease into account and they don't take the other pieces. So what I would rather do, instead of focusing on, I would rather keep things open and find a way to make it less able to transmit disease. So if it's possible, better to have the libraries open and only let every other computer be in use at a time. Have signs. Chairs need to be 6 feet apart. I know it's hard, but it's a lot harder to lose your livelihood than it is to have tables in a restaurant spaced 6 feet apart and have hand sanitizer at the door when people walk in. So again, it's minimizing harms on both sides. And I personally, and you're asking my opinion, and this is where the public health world is, I would try to minimize the spread and maximize distance, but keep facilities open, because I do think that this is going to be a long haul.
Okay, I appreciate your candor in that answer, and obviously, we're kind of on the fly on this. It's big decisions, not just at our level of government, but that's the one that we can participate in. That's an interesting answer and different than maybe I would have expected. The easy thing, of course, would have said you need to shut it all down and keep it closed until it's not anymore. But you're absolutely right. I mean, my kids aren't in school right now. That was it was kind of a controversial decision for our personal school. It was they go to a private school, and so it was that was something that definitely they were going to stay open, and then they didn't. And it's hard to know as a parent, or I'm sure as a school administrator, what's the right thing, because you don't get this year back, right? I mean, you don't,
right.
You got to learn things. You can't go on to 5th grade math or whatever if you haven't finished learning 4th grade math. It builds on itself, all the other classes and stuff too. So now, are you going to set everybody behind? It's a hard decision, I just don't think the opening decision, when we're going to reopen facilities, whether it's our libraries or it's the state doing it, or businesses, that's also going to be a hard decision, because some people will say you're jumping the gun too soon. Right. And if you could just kind of keep us posted what your guidance is and kind of what you think best practices are and so forth. We need the advice, because we just don't really have the information. Your presentation was excellent in laying this out, but it's very tricky to know what's the best thing to do because we recognize, I think we all do, we're hurting citizens by closing these facilities. And, but we don't want to reopen them too soon either. It's just, I won't belabor it anymore, but I appreciate your candor on that, and it does give us, I think, some things to think about. Thank you.
Thank you.
We know we have to get Dr. Sunenshine back to her very important
Mayor?
work, but Councilwoman Pastor.
Oh.
Hold on, Sal, or Councilman DeCiccio. Dr. Sunshine, you mentioned the schools, and I'm not really sure how the schools came about in closing, because I am aware that there was a statewide conference with DHS and the governor discussing the whole situation and highly encouraging not to close the schools. However, soon after that happened, a day later, schools were closing. And I don't think schools are going to reopen. And I'm hearing that we probably stepped out way before than what we should have. I'm just trying to understand all these domino effects, because it hits all of us at a different space and timing. It's really the timing.
Right, and I think that the timing is critical when it comes to these other social distancing measures, and I want to be very careful here. I respect the governor, and I understand that when these decisions are made, they have to take a lot of different things into account. I am very focused on public health. It's what I do for a living. It's what I'm trained to do. And I know there are politics, and I'm not a politician. So I just have to answer from a public health standpoint that because of the way this disease affects children so much less than adults, the literature, the science out there tells us that closing schools just doesn't have any effect on the spread of the disease. So that is why public health was really urging the governor not to close schools. I will say that if you read the governor's proclamation when he does close schools, it's very clear that he states, we know that this will not affect the spread of disease. So he knows the science, but there must have been something else that was pressuring him to make that decision. And I respect the governor, and I respect the position that he's in, and there must have been other factors that exceeded the science in this case.
Thank you for that answer, because that did add some clarity.
Councilman DeCiccio.
Oh, thank you, Mayor. And I've got to tell you, I really appreciate this presentation. There's just an incredible amount of panic out there right now in our community. And anything you can do to help reduce that panic is critical. I think our biggest enemy is not as much the virus as it is the panic right now. The over everything, the runs that they have on toilet paper, the runs that we have on our stores right now. Is there a message you can deliver to the public, Doctor, that really helps reduce this crazy point we're at right now?
Well, I couldn't agree with you more, and I appreciate that. And what I want to say is that you all are in the best position to deliver that calming message. And I think, this is scary for people. It's a new virus. They don't know what to expect. We didn't really see this kind of reaction during the pandemic flu because I think people are familiar with influenza. When I look at a coronavirus, I think, gosh, this is what causes colds most of the time. So I have a little more of a background that I don't have that same tendency to panic. But I think the message that we want to deliver to people is that public health has been doing this for a long time, and we know how to prevent the spread of all respiratory viruses. That, I know people are so sick of hearing us say, don't wash your hands and don't touch your face, but that is within all of our control. And we can do that, and we can keep ourselves from getting sick. We can teach our kids how to do it. And then we can keep our older adults and those with chronic medical conditions, we can make sure they know how to protect themselves and check on our neighbors. If they're on their own, make sure they have things to do, things to keep them occupied. Let them know they can go outside. Make sure they have food. Allow our people at highest risk to stay as sheltered and, away from sick people as they can. And the rest of us do those things that are within our control. The more control we have, the less we tend to panic. And I need to rely on all of you to do that, because you're in a critical position where people are listening to what you have to say. Particularly you, Mayor Gallego, you have a critical role in this, and I just appreciate everything you can do to pass on accurate information.
The other point deals with the closing of the libraries, and I think everybody's trying to do the best thing that they can right now. There's just so much information out there. It's hard to land on it, you know what I mean? And put a policy in place and a direction in place. I think is what you're seeing. So when we close the schools and we close all access down, and I grew up very poor, so I know what this is like. So the people that are least able are the ones that least likely going to fall behind in that education point that Jim was talking about. I am really worried about that. Like my kids, I've got a computer for them. We're all set, those kinds of things. But there's, I would say, a significant portion of our public right now, and with their children, that have no way of getting this online schooling. Right now, my kids are in class. They're doing online virtual class, right?
Right.
But there are a lot of kids that cannot do that today. And we are literally putting them backwards in time. I mean, if there's a way you can communicate to the state and others, open our schools, I would be helpful in that. I would love to see our schools open again, especially if they have no impact, but very little impact on the disease. I really believe our children need to be back in the classroom. I'm worried about that.
I worry about that as well. But again, I have to respect the governor's decision.
I think the governor's doing the best job he possibly can right now.
Yeah.
I'm very worried about these kids that are out. And if there's a way for us to work together, too, I don't know how that's done right now and how that communication is done to where the county, the state, the cities kind of put together their own policies and figure out, hey, what are we going to do direction-wise as a state and a county? That would be helpful, too. Right now, I know everyone's trying to work it together, but it's still kind of a mishmash. There's no formal, like example, when we have a major emergency, which I think this is, everybody gets together. You have all the police departments communicating, the sheriff's office, the police departments, everyone's communicating. But I'm not seeing it as much now as I would have under a situation like that, like an emergency management group. Is there anything like that, Doctor?
Since you raised the question, one of the things that we've talked about, particularly because the city of Phoenix is just such a huge population, one of the things that we've talked about is suggesting that maybe the city of Phoenix have a liaison in our emergency operations center. We've been running 7 days a week since really January 25th is when we identified our first case. We're constantly running, and there's a lot of communication that needs to happen. We try to have weekly webinars with municipalities, with healthcare partners, childcare, schools, but there's nothing that can substitute for having a liaison there in the middle of things to participate in the discussions, to kind of carry all those questions back and forth, and that is something that we're certainly open to and would offer for City of Phoenix to consider.
And my question to Ed Zerker, Ed, not why didn't we, because that's moot at this point. We got to keep moving forward. Are we going to be committing to have somebody in that room being able to share information from both sides, retrieving information, and also sharing information that we see on the ground? Ed?
Yeah, Council, I'm sorry, I was just checking. We are connected to the state EOC. I'll look to Milton and the chiefs about connecting with the county EOC. Yes. We will absolutely.
So we will have somebody in that room. Perfect. So you have a commitment from us now that we're going to have somebody in the room so that we can work together as a team.
Let me just ask Chief Kalkbrenner to respond to that.
Mayor, members of the council, Mr. Zucker, we currently have a liaison to all of the Arizona Health, Maricopa County Health Department, the Arizona State Department of Health Services, and they liaison daily on a conference call to find out what the best practices are at this time. So we don't have somebody physically in their EOC, but that's something we could move in that direction, particularly with the opening of our EOC.
And so,
And
I mean,
Chief
I think
Kalkbrenner, if I
the
could-
request is to have someone, I'm sorry. I think the request here is to have somebody in that room, because having somebody, if this is that big of a crisis, which I think it is, we need to have people in the room, not just on a call, but in the room to be able to hear and be able to see what the body language is as well. So thank you for that, Chief. And do you know when that's going to start happening?
Sorry, we're looking at each other way across the table. We will connect with Dr. Sunenshine and her staff and get someone in there right away.
Thank you for that.
And
Okay,
if I may clarify, there's a county EOC and emergency operations center that is coordinating the emergency management aspects, and as is the SEOC. And then Maricopa County Public Health has its own emergency operations center. And what I believe we're suggesting in this case is to actually have somebody in the Public Health Emergency Operations Center where the public health decisions are discussed. So I just wanted to clarify that's the invitation. And of course, I'm sure you have a liaison in the emergency operations side. It's just the public health side that I think it could really benefit all of us.
Thank you. We will, Chief Kalkbrenner will get someone detailed to that right away. Thank you, Dr. Sunshine.
That's huge.
Thank you.
Yeah, thank you for that. That's huge.
Thank you, Dr. Sunenshine, for taking time from your enormously busy week. We do not know what the week has in store, but we know it's going to be a busy one. So thank you for taking time to present to the Phoenix City Council.